As has been discussed here before, people of color in Maine are getting ill from COVID-19 at strikingly high rates when you look at the percentage of the total population. Could you speak a bit about your understanding of the kinds of factors that are causing people of color to get sick at such high rates, and what would you say to those who might look at this data and conclude that blame for the problem rests on the communities themselves?
Oh, well, okay. Well, let's take that one squarely at the outset. And Governor, can I turn that over to you first?
You know, I think we've said it before. This virus is race blind, ethnicity blind, religion blind, color blind. This virus doesn't know your political party, your geography, doesn't know what country you came from or how long you've been here. This virus is an equal opportunity destroyer.
I completely concurred, Governor. The notion that any one individual, let alone a group of individuals, is to blame for contracting a virus that's out there in the community, in the air around us, doesn't really pass any scientific muster whatsoever. Now, Kit, you asked about some of the factors. There are a number of factors, but I'll highlight two that are of concern and that we're trying to think through more carefully. The first is the nature of the employment that many individuals of color have. What we know is that the nature of that employment often puts them in the direct line of the virus. They're forward-facing, customer-facing roles. Secondarily, the nature of that employment often means they can't work from home. That's one set of factors. The other set of factors that we are working really closely on is lack of access to health care. It's all well and good to say that our laboratory will run samples. It's all well and good to say that providers have swabs, but if you don't have a primary care physician, a lot of that bridge is one that's difficult to cross. So we've been working with providers across the state, particularly in areas of the state where we know the problem to exist, to try to see at a minimum, how can we arrange for testing even if someone doesn't have a primary care provider? Because we know even that hurdle can be a very significant one. So that overall architecture of making sure there's greater access to health care, whether it's primary care, testing, and follow-up, is a big goal that's right in front of us right now. So,
and we are paying for testing for those who are uninsured.
That's correct.
Medicaid funds.
That's correct.